Hi, y'all. We're going to give folks maybe 2 more minutes to hop on, and then we'll get started.
Question in the chat box.
Okay, I think we're going to go ahead and get started, and then folks can continue to hop on because we have a short period of time. So first and foremost, I want to say good evening to everyone, and thank you for joining us. My name is Lisette, and I'm an organizer with NextGen America. For those of you who do not know, NextGen is a political action committee that is dedicated to mobilizing and empowering youth ages 18 to 35 to become politically engaged and civically active. We wanted to have this town hall to discuss COVID-19 and how the outbreak in Michigan is related to public health and environmental disparities. If you should have any questions throughout the panel discussion, please drop them in the Q&A section, and we will get to them during the later part of the event. Now I'd like to take a few minutes to allow our panelists to introduce themselves. Meredith, why don't you start us off?
Thanks. Yeah. Hi, everyone. Thanks for being here. My name is Meredith Gillies. I am an organizer with Clean Water Action. We are a nonprofit that works to protect our environment, public health, and ensure that every Michigander has access to clean, safe, and affordable drinking water. I am here today personally because I live in Ypsilanti, and that may not be a hotspot for COVID-19 right now, but we are seeing a lot of the same disparities that we're seeing in other parts of the state right here, with the zip codes with the highest African American populations experiencing the highest rates of infection. We're seeing a quarter of the deaths are African Americans compared to 12% of the population in my county. This is something that's hitting very close to home. So I'm happy to be here and talking about this really important topic.
Hi, everyone. This is Justin Onwenu. I'm an environmental justice organizer with the Sierra Club based in Detroit. Happy to be here. The Sierra Club and especially the environmental justice program focuses primarily on securing access to clean air, as well as fighting for clean water and green jobs, good green jobs, and things of that nature. So there's a lot of work to be done, and I'm happy to be on this panel with you all.
Hi, everybody. I'm Melanie McElroy, and I have been working on democracy reform issues, particularly voting rights and election protection around the state of Michigan for about 8 years now. And I predominantly focus my work in communities of color, in urban centers, and mostly all nonpartisan organizations, block clubs, faith centers, groups of people that just want to protect the vote in their neighborhoods. So I train on voting rights, on what we can do to fill in that gap between what is the law in Michigan and how that actually plays out for some of our most vulnerable residents. So I didn't immediately understand the connection between my work and Michigan's health, but when NextGen reached out to me, it was pretty clear that the people that have been affected by COVID-19 are the same people that are being affected by lapses in our democratic process. So I think there's a really important intersection here, and thank you, NextGen, for bringing us together to discuss it.
Hey friends, Abdul here. I am a physician, epidemiologist, progressive activist, and former health director for the city of Detroit. My work is really focused at the intersection between politics and public health, with a focus on equity, justice, and sustainability. I just recently released a book called Healing Politics, which diagnoses an epidemic of insecurity. And a lot of my work in and around the state has really been focused on both articulating the causes and consequences of the kinds of insecurities, be they financial or political or public health, that tend to result in the kinds of outcomes that we see right now. All of us know we're living in the middle of a pandemic, and that's why you're seeing us in tic-tac-toe form rather than in person. But this has also forced us to ask questions about how we got here. And I believe it has a lot to do with the fact that we've cut public services in our state and our country, and that we've left people on the slippery edge of viability. And so I'm really looking forward to being a part of this incredible panel. I've gotten to interact with, I think, everybody on the panel before, and really look forward to learning from you. So thank you for bringing us together, Lisette, and NextGen, and I look forward to participating.
Thank you, Abdul. So COVID-19 has served as an unprecedented time in terms of water access, as water utilities have temporarily halted water shutoffs and restored services to thousands of homes throughout Michigan. Access to clean water, as we know, plays an important role in fighting disease outbreak, amongst other obvious benefits to public health. Meredith, what are some disparities that you've seen regarding access to clean water during this time?
Yeah, so I think, disparities regarding access to water, like Abdul was mentioning, and Melanie as well, is a part of an intersection of all of these different disparities. So, we're seeing the communities that were hit hardest, or that are being hit hardest by COVID-19, are also the communities that were already struggling with water shutoffs before. And so this is something that community organizations like People's Water Board Coalition, We the People Detroit, Flint Rising, have been working on these issues for years and decades. So, when the pandemic started and, became a big issue in our state, that was one of the first things that we focused on, was following the lead of those community organizations and, working to ensure that everyone has water. This was, an issue before, but during a pandemic, when you're asking people to stay home, it's incredibly important, obviously, to have running water in your home, to be able to wash your hands, be diligent about sanitation, and, not go outside. You need water. So thankfully, with the pressure that all of our partners were able to put on the governor, we were able to get an executive order halting water shutoffs and ordering cities to reconnect folks who had been shut off. Unfortunately, this was only a first step, and it did not fulfill a lot of the things that we were asking for and a lot of things that we're still pushing for. So, for example, the communities that have the highest numbers of shutoffs, Detroit is the highest. There's an estimated 10,000. It might be more. That's something that also contributes to the problem, is the lack of data and transparency on what homes are shut off. But yeah, estimated 10,000 in Detroit, another 5,000 in Flint, up to 1,000 in Benton Harbor, Saginaw, other communities across the state. So it's a big issue. And the reconnections are not happening quick enough. So, that executive order was a good first step, but we need a lot of resources to be able to ensure that when we're reconnecting people, they have safe water. So if for homes that have been shut off for months or years, there's often contamination issues related to standing water in those stagnant pipes. That's a petri dish for bacteria and other pathogens. It's also a problem relating to lead contamination. We're also talking about communities that have not had the money to update their infrastructure and are more likely to have lead infrastructure. So all of these things intersecting. So so that's been a huge problem that goes right along with the disparities we've been seeing well before this pandemic happened. And
I guess as a follow-up question, what would be some steps we can take to ensure that people have access to clean water, like post COVID-19? Because obviously, like, water is a human right. So
yeah, totally. Well, there's some things that folks can do right now. First, so something that People's Water Board Coalition, and we have joined them in calling for, is a task force in Detroit, a community-based task force to pull together all the resources necessary to expedite the reconnection process, as well as erecting emergency water stations to fill that gap as folks are waiting for their pipes to be replaced and their water to be reconnected. So we have an action on our website, cleanwater.org/Michigan. Click on Act Now. There's a pre-written message. You can edit it if you'd like to. That goes right to Governor Whitmer. So I definitely encourage everyone to do that. We also have a utility shutoff action, which, do that as well. But I think, as we're moving forward, it's really important that in addition to addressing these urgent needs of our communities, we are highlighting the systemic vulnerabilities and inequities that have really been laid bare by the pandemic. So, we've really seen these things that were already problems. This pandemic has put a spotlight on them, and we need to be highlighting that right now. So we need to be talking about the fact that water shutoffs never should have been a thing in the first place, the fact that we need to restructure payment to income-based repayment as opposed to usage-based, the need for a polluter pay policy so that polluters are paying to clean up the contamination that they cause, which will in turn give us more funds as a state to invest in updating our water infrastructure and protecting the Great Lakes. So we really need to be talking about these sweeping policy changes even before, even now. We really need to be building that momentum so that when we come out on the other side, not to say that there will be a post-COVID time. I mean, the COVID will be with us for a very long time. But once we're on the other side of this, we need to build up the momentum so that we have, the groundwork to really get that systemic change that we need.
Thank you, Meredith. So 48217 in Detroit is one of the most polluted zip codes in the nation. We are the frontline community for climate change and environmental racism due to our proximity to truck traffic, the International Bridge, Marathon Refinery, to name a few. We know that the exhaust from trucks idling releases particulate matter into the air that then gets absorbed into our bloodstreams and causes respiratory issues like asthma. These respiratory issues have been exacerbated by COVID-19, but the issue of air quality has been going on for years and will continue with a new international bridge. Justin, what work is being done to ensure Detroiters have access to clean air after COVID-19 is contained?
Yeah, so thanks again for having me. The issues that you're referring to, which is, pollution driving asthma and respiratory issues, cancers, has been going on for a long time. I think it's important to try to look at those root issues that have led to that. So when you have, redlining that has driven a lot of racial and residential segregation, you have concentrated poverty and the fact that a lot of jobs are located outside of the city. And so what that does in terms of concentrating poverty, disenfranchisement, whether it be just voter suppression, criminal justice issues. So there are a lot of issues that lead to, I think, communities not having the power necessary to stand up to the corporations that you've mentioned, Marathon Refinery being one of them, and others as well. And so when you think about who would allow a refinery, a steel plant, or other major industries and polluters next door to them, what city government, and what communities are targeted for those sorts of sites. And you look at it, it ends up being environmental justice communities that don't have the resources, power, time, etc., to fight back. So I do think it's important to draw a broader lens and looking at why are communities that are Black, brown, low income, the ones where these industrial centers are always located. In terms of work that's being done, I think there's a lot of work that's being done to put pressure on EGLE, which is the Michigan Environment, Great Lakes and Energy Department. Right now, they're still planning to move forward with permit hearings for companies that are seeking to raise emissions. So AK Steel is a company that when they violated Clean Air Act standards and have, for years have been going over the limits that have been set for them by the federal government and by the state government, they continue to seek to raise their emissions instead of to basically say, all right, we passed the limit, we'll just raise the limit instead of lowering your emissions. So there's a lot of work to put pressure on EGLE to take a stand against companies like that who continue to just flagrantly and blatantly violate the law. And there's also just, I think, when it comes to the state agencies' interaction with communities, there's a lot of problems around just the crisis of democracy. So who gets to participate, whether it be virtual hearings, who has access to internet to participate in these hearings? When it comes to in-person hearings, who has the time to take off from work or to take off when childcare isn't provided at the hearings? Who has the capacity to engage in that fight? So there are a lot of issues, I think, with a state agency that's supposed to be protecting people's health and the environment, but has a lot of work to do. There's also, I think, a lot of work that needs to be done on how we think about and how we calculate risk and impact and pollution. So right now, companies are evaluated. If you need a permit in your company A, the state will look at your permit and say, okay, you only want to release this much pollution, go ahead. But the state does not do a good enough job looking at the concentration of industries in particular in small areas. So if you have company A, B, C, D right next to each other, what difference does it make to the community if all of those industries are located right next door to each other? And so you end up with a lot of companies that are approved for permits, but they're all concentrated in a small area. So you end up with hotspot areas where you have dozens of industries concentrated in a 1 mile radius. So there definitely needs to be more thought and more action around calculating pollution and impact. And then the last thing I would mention is that we're putting pressure on companies to actually address the health impact and just the negligence and the irresponsible behavior. So, getting companies, whether it be through state action, whether it be through lawsuits, or whether it be through philanthropy, getting them to fund things like air filtration systems to at least mitigate the impact that they're having on the community. So there's a lot going on government action, on pushing companies to do better, and then also just systematic change on how we measure impact that's going on right now.
So for me as a community member, I'm from Southwest Detroit. What would you say is like the biggest thing that people in the community can do to help put that pressure and apply that pressure?
I think there have been so many studies that are just laying bare very explicitly that the pollution that we're seeing in communities like Southwest Detroit is directly tied to a lot of the health disparities. So there was a Harvard study that recently was released that showed that particulate matter, PM 2.5 specifically, is tied to the death rate and just the fact that a lot of folks are getting sick with COVID. So I would use that messaging, especially during this moment, to contact Eagle, whether it be through email, whether it be through phone call, not only Eagle, but the governor's office, to say, we've gone for such a long time not addressing air pollution because we think that, we can't see it. It's just not a big deal. And if there was ever a time for you to get a lot more serious about it, it's right now. So I would say contacting the governor, contacting Eagle, and just asking them to take more aggressive action on holding these polluters accountable, I think, is the number one thing.
Thank you so much. So we know that there's a push in Michigan for absentee voting, specifically for the August election. Melanie, what is the work that's being done to ensure public safety for the upcoming events? And also what is being done to ensure that voter suppression isn't going to happen via absentee ballots?
These are great questions. When you think about the restrictions that have been put on our entire lives through COVID-19, the first thing that went through my mind is, oh my gosh, thank God we went through the Michigan primary election just before the shelter in place order came through. But as we've seen, neighboring states were not so lucky. We had a lot of issues in Wisconsin. Other states have been bracing for how to deal with this idea of preserving our democracy. We don't want to cancel elections. We don't want to delay elections too much. But how can we make sure that they're accessible enough while using these different precautions that are now in place? So Michigan, as you know, has 4 different election days throughout the year. We've already seen the March election. Some of our areas around Michigan, none of our major cities, luckily, but some of our more suburban and rural cities have elections on May 5th. They did have the option, if they wanted to wait and delay those elections until our August primary. But some of those localities are still going to hold their local elections on May 5th. So the Secretary of State, through executive order, has issued a couple of new guidelines, and we're using those to plan ahead, although we don't know exactly how things are going to change socially, medically, between now and August. So what's happening now for the May election is that one polling location will be open for each village or city that is voting. So if someone, for whatever reason, has to or wants to vote in person, they still will be able to. They will obviously be encouraged to distance themselves socially from other people within that space, to wear masks, gloves, whatever makes them comfortable in that space. And most importantly, they're encouraged to take the opportunity to vote by mail. As part of Proposition 3, which was passed in Michigan, no reason absentee was one of our most exciting reforms. And we've been implementing that now for almost a full year. And it's been very exciting to see this opportunity be open to people who otherwise maybe were not able to make it to the polls, but didn't have one of those designated excuses. They weren't necessarily working, they weren't necessarily out of town. It just wasn't convenient or feasible for them to physically get to their polling location. So we're really expanding that due to the fact that we have had a couple of major elections since Prop 3 passed. The Secretary of State feels comfortable that they were able to properly test and secure that many more absentee ballots being used than normal. So that's going to be the best way to protect people from having to go out in public for this upcoming election, is to vote by mail. A lot of chatter has been going around since we heard a lot of news come out of the Wisconsin election that they had issues with their vote by mail system, that there were ballots found at the post office in a big box days after the election. But I can assure you that Michigan is taking this very, very seriously. We have a Secretary of State who has built her career on secure and fair and open elections. So we on the ground very much trust the executive orders and the precautions that are being recommended through our Secretary of State's office. The issue for me as a community organizer and as someone who has worked on the ground on elections for a long time is to make sure that people don't get left behind. Because yes, while vote by mail will now be available to everybody, that means that folks need to be registered in time to get on that automatic list. They're going to send everybody an application to vote by mail, which is a new thing for us. But you have to be registered within a recommended about 15 days before the election. So you can still do that online. You will have to have identification that matches the DMV file to register to vote online. But that's still something new that we can do. That's going to capture a lot more young folks. When we talk with NextGen, we like to shout out that this is something that young folks had been asking us for a long time. And as activists, we're happy to see that pass for people who are eligible to vote on, to register to vote online. But we're going to need to make sure you get those in as soon as possible because there will be an additional time needed to make sure everyone gets these applications. We don't want to wait till the last minute and burden the system even more than it will be already. But that's an option that we have. So looking forward to August, even if our social distancing guidelines have been reduced, even if we are allowed to go out and congregate in public, we recommend that as many people as possible take advantage of the fact that we do have a no reason absentee vote system in Michigan. And then as far as voting rights go, I mean, a lot of the other issues that we have don't change. There's still an overwhelming amount of misinformation around Michigan's voters' rights. The biggest one I see in my work is that people with felonies have the right to vote in Michigan, and a lot of them don't know this. There's a lot of misinformation around the community that's spreading. And as you can see, people within the criminal justice system right now are suffering in some of the most alarming rates of any of us. And so it's so important to have people touched by that system, make their voices heard in our democracy, and know that not only can they vote with a felony record, they can vote while in jail awaiting trial, they can vote on parole, they can vote on probation. And these are just some of the things that if we don't have access to this information and if we're not being reminded of what voters' rights are in Michigan every year, that's where people just tend to fall away and don't even bother to get involved in the process. So it's also important to look out for non-English speaking communities. I can tell you from personal example, my mom is from Guatemala. She didn't become a citizen or a voter until 2008. And it's not always an easy process for people, even if they've been here a long time and speak English really well. It's a complicated and intimidating process sometimes to go and vote. So we encourage communities not only to help translate materials, talk to your neighbors about what's on the ballot, make sure that as rules are coming down the pipeline pretty quickly as it relates to COVID-19, that people in your family or around your neighborhood or in your church who aren't super great English speakers understand the changes that are happening. So that's one thing that I would say. But if people are looking for things that you can do, ways to get involved and step up during this time, one thing you can do is sign up to be a poll worker. We're always looking for people who are tech savvy, who are quick on a laptop, who maybe are bi or trilingual, understand the culture of your community. We want to make sure that voters feel comfortable when they go to the polls, that they see people who look like them, that they feel comfortable speaking to people working on the other side of that desk, that they feel comfortable asking questions and getting clarification. So whether or not we're voting in person in droves like we normally do, the Secretary of State's office and your local clerks are always looking for people to step up. So one thing you can actually do is go to mi.gov/democracymvp. It's a new campaign push that they're doing to make sure that we get energetic new poll workers signed up every year. So that's one thing that you can do to get involved. Another thing while I'm at it is make sure that you're also signing up to get on the redistricting commission for Michigan. We have such a unique opportunity to form a nonpartisan coalition of average citizens who have the opportunity to voice their opinion when we redraw our district lines in Michigan. And that's at redistrictingmichigan.org. So there are a couple ways that even though it may not feel the same when it comes to election day, even though we may not be standing together in lines around the block, there's a lot that average people are going to need to do to help step in and participate and make sure that nobody gets left behind, because even when we do change the rules for the better, through Prop 3, that's when we added online voter registration. That's when we expanded absentee voting to be for anyone, regardless of whether or not you're out of town on election day. And we also extended the window in which you can register to vote. It used to be you had to be registered 30 days before an election, which meant that a lot of people were out of luck if they didn't get to it in time. Now you can actually register all the way up to the election. You can go to the clerk's office and in person fill out your registration and either take a receipt to the polling place normally, or register, cast an absentee ballot right there at the clerk's office. Obviously, this all may be a little bit different through Prop 3, but these were huge changes that we made. And so Michigan is going in the right direction when it comes to counting our votes and making sure that we have fair elections and that we're including as many people as want to be part of that process. But it's going to go through a definite little swerve in 2020 due to COVID-19 and the changes that that's making to all of our lives. So as these different rules come down the pipeline and recommendations from the Secretary of State, it's so important that those of us who are community leaders, that are organizers, that are active in our churches or in our schools, listen carefully, because you're going to be the people that your neighbors come to when they have questions, or you're going to be the Facebook page that people look to for the right information. And as we've seen with this to any other issue, misinformation spreads like wildfire, and we can still expect the same type of foul play on Facebook that we saw in 2016, that we saw in 2018, with false memes talking about false election practices. And because people will be uncertain this year, I would expect that to even be a little bit more frightening. So one thing you all can do is just make sure that you're only getting information from trusted sources, and that when you share that, you direct people to the right places to get help. I don't know if you can see behind me, I have some lawn signs that are just all over my house for the best helpline that we can direct people to, the 866 Our Vote hotline. That's a national call center that is run by the Lawyers Committee for Civil Rights. And any question about where your polling place is, what to do if you get turned away, anything about Michigan election law can be directed there. If they can't answer it right away, they punt it down to one of us, to either the Michigan Voice, the NAACP, the ACLU, one of our partner organizations here on the ground. So there are many ways to get your questions answered. And I just recommend that you all sign up to be part of the solution and try to close that gap that leaves folks behind.
Thank you so much, Melanie. That was so much like really valuable information. I think, and specifically, like one thing that I feel like a lot of people aren't really focused on, or not that they're not focused on, but they don't realize anyone can apply to be a part of the redistricting commission. And I think that's a huge opportunity for us to really, really have a say and engage with our political system. So thank you for reminding us that. Abdul, as you know, Michigan has the highest COVID-19 death rate in the country because it has very low rates of testing. Per 100,000 people, only around 795 people are being tested. With plans to reopen the economy, how does this play out in terms of the virus being contained?
Yeah, look, I think what's clear, let me just sort of step back. I just want to lay a little bit of context for how a pandemic works and a response works, why the testing is so critical, and how we ought to be using it, and what it's going to mean for us to reopen. I think about like a pandemic like a fire. If we were to see smoke coming out of our toasters, we'd all know that there was potentially a toaster fire. Ideally, right, we'd have our fire alarms ready to go, and they would start beeping, and we would look at our toaster and be like, oh God, we have to do something about this. We would, unplug the toaster and then put the fire out. That's how we should have handled COVID-19. What that would have looked like is a very intense on-the-ground response to the outbreak in Wuhan, and then being ready to go when the first American case hit. What's interesting is that it seems like there were cases without our knowing it in the United States well before we even knew, and which means that it's like we took the batteries out of the fire alarm. And then when the fire spreads beyond the toaster, you really want to put it out in the house. And that is called contact tracing in epidemiology in public health. What you do is you identify every single individual who's who's got the disease. You find out who they might have exposed. You get testing out to all of them immediately. For the folks who test positive or for whom you don't have a positive test, you mandate that they be kept at home until they clear the virus. We very quickly exhausted our capacity to do this because, of course, we've defunded public health. And that's like, every neighborhood has a fire station. That'd be like furloughing the fire staff, which in effect, what we've done with the defunding of public health for a very long time. And now we're dealing with a 4-alarm fire that is raging through our country. And the only way to stop that was through mass mitigation, mass social distancing. So basically saying, look, we can't identify every single individual who has this disease. So what we're going to do is just make sure that everybody separates from each other so that they can't pass it on. Because of course, with an just like with a fire, with an epidemic, every time the fire hops, it's not like it leaves the person it hopped or the place it hopped from. Every time the virus hops from one person to another, you're just multiplying virus. So you just have more of it. Just like fire multiplies, disease multiplies. And so this is what happened. And now we're in week 6 of social distancing. And the good news is that it looks like the number of cases has somewhat leveled off. The bad news is that it has caused a tremendous amount of disease and death. And the worst news is that that has been disproportionately borne on Black folk in Michigan and across the country, and low-income folk. And that speaks to the fact that we have fundamentally decimated our public services in this country, and we have created an economy that leaves a lot of people extremely vulnerable. And that all maps out, right? The thing about disease is that, or a pandemic, is that you don't just look at the pathogen, you also look at the nature of the host and the environment. And in America, the environment has been beating up on the host for a very long time. And nowhere is that more clear than in low-income communities of color, where you've had a cascade of terrible public policy decisions that have maintained and often driven structural racism that have led folks to be exposed to all of the predictors of bad outcomes, whether that's asthma or diabetes or anything else, which has ultimately led to a higher probability of COVID-19 death. So here we are, and we are all social distancing. The question now becomes, what's the way out? Well, in order for us to be able to stop mass social distancing, we have to be able to precision social distance, which is another way of saying contact trace. And in order to be able to do that at scale, you need a lot of people with a lot of tests. And the fact that we have been so bad at testing is in part because with the testing, so in part mainly because we've had limited tests, and that is frankly just about the failure of the federal government to meet the needs of this moment. But the other part of it is also that we've just been using the tests we have stupidly. And what I mean by that is any test that you use should tell you something new. And the way we've been using tests right now is after people get really, really sick in the middle of a COVID-19 pandemic and have COVID-19 symptoms, then we test them to tell us exactly what we already knew, that these people probably had COVID-19. And here's the even crazier thing is clinically, it doesn't really change your management if you think they have COVID-19 or they don't. It doesn't really matter if you have a positive test. You have people who are in lung failure. You can do a CT and identify the classic ground glass opacities that is the hallmark of COVID-19. And basically you treat people by ventilating them, right? And so we've used all of our tests that way rather than using our tests in ways that help us to understand how COVID-19 is moving in and around the population. So we really just don't have that baseline information. And there's a lot of evidence to suggest that there's actually just a lot more asymptomatic COVID than we thought there was, and that it's far more widespread than we thought it was. And so all of this points back to the fact that we just need more testing, and we need to use our testing outside of clinical circumstances where it gives us an understanding of how the disease is moving and whom it's moving and who it's affecting most broadly, and using that in particular to identify asymptomatic cases who are the super spreaders. Because, obviously you tell everybody to socially distance, and all of us are doing our best to socially distance. And if you're not, you need to start doing your best to socially distance. But ideally, we're all doing our best to socially distance. But let's be honest, right? If you're not coughing and you don't have symptoms, your probability of, we'll just say, being less stringent about your social distancing is a lot higher. And with the amount of asymptomatic spread that we've seen, it's highly likely that the real spread is happening from people who don't know they have it. So we need more tests. We need them out in the community. The fact that we haven't had as many tests and we haven't been able to use them in ways that help us to limit the asymptomatic spread is part and parcel of why we have such a terrible outbreak here in Michigan. And we've got to do better. And that starts at the federal government. You know, like I don't have to tell anyone who's probably here with us that Donald Trump has shat the bed, but he has absolutely shat the bed. And beyond that, it's been hard because the local response in a public health response is really predicated on what happens federally, right? There's a cascade of outcomes that happen, and our state officials and our local officials haven't been able to engage. But also, you know, part of it is also that in the absence of strong federal leadership, we should have had, I think, a little bit more nimble leadership at the state and local level, and we should have been focused entirely on low-income communities of color, because we knew that there's a social physics to disease that would have followed, and you know that the response hasn't been that way, unfortunately. And I hope that moving forward it will be.
Thank you for that. So, you know, in America, we're rendered to believe that our political capitalist system is the securest and most ideal system in the world. And I feel like in these few short months of COVID, it's laid bare all of the ways that our system has failed us, from lack of access to healthcare to employment insecurity. We're seeing how fragile our economic structure is. And we're afraid, we're scared. There's a lot of uncertainty, and there's foreshadowed recession, potentially depression, and new waves of COVID potentially happening in the winter. How can we leverage this moment for change?
Yeah. You know, I think Lizette, I really appreciate what you said, and I want to tweak it a little bit, because I think for folks who suffered on the wrong side of America's insecurities for a long time, they've known it was broken forever.
Yeah.
It's just that those of us who have the privilege to not have to see it, and for a long time have chosen not to see it, all of a sudden we're starting to see it. And I guess that's a good thing, but it's also extremely maddening, because the thing about preventing disaster is that you have to do it before the disaster happens, not after. So all we're doing right now is responding to an extremely terrible situation. And then the question becomes, are we willing to do the work to prevent the next one? And yes, there will be a next one. And it may not look like a virus pandemic. It probably will look like a climate event, but there will be a next one. And the frustration is that we have assented to a governing consensus in this country that tells us that the best way to provide public goods is through private means, excluding the people who need them most and allowing the people who profiteer off of them to profiteer massively. That's how we've done things for a long time. I think we have a responsibility in this moment to be able to articulate why the past left us so insecure to the present, and why the present has to be means of building the future that won't. It's just that. You know, the ironic thing is I wrote this book well before I knew that there was going to be a pandemic. And I talk about this idea of an epidemic of insecurity. And, you know, when I first wrote the book, a lot of folks were like, well, you know, I don't know that this actually speaks to where we are. And the frustrating thing is that now everybody's like, yeah, that's it. But it's too late. And that sucks, because the whole point is not to be right. The point is to improve people's lives. And we miss that opportunity. So I think we have a real responsibility, all of us, to be asking, what does it mean to build the kind of political, economic, housing, justice, healthcare, food systems that protect us from the kind of insecurity that too many are suffering right now. And I think that this has created the space for it. And I just want to make a final note. You know, you focus on folks who are aged 18 to 35, and I guess like I'm like sunsetting out of being able to call myself a young person, unfortunately. But as a young person, fellow youths, I think our generations, and I say that recognizing that like millennials are now old people. have seen the consequences of the brokenness of our system in profound ways multiple times, right? I was in high school when 9/11 happened, and then my country went to war with people who looked like me and prayed like me for 10 years just to create more war. And then 10 years later, or 8 years later, as I was graduating from college, or starting medical school, we had the worst financial recession since the Great Depression. And then 10 years later, as I was raising my 2-year-old daughter, we are all bunkered at home because we're in the worst pandemic since the Spanish flu. So like right now, we're like every 10 years, something really shitty happens. I hope this is a wake up call for our generation to like stop shitty things from happening. And I think about my 2-year-old and like what she deserves. And I hope that we are willing to use this moment to build for them. Because in some ways it's somewhat too late for us. But we have a choice about what we do for them and the world in which we raise the next generation. And I hope that history books will tell how we used this to build out in the future.
I think that from the standpoint of a community organizer, the biggest opportunity for us young people to leverage this moment is to really seek out community and to build space with one another. I think that there's so many people who are doing critical work, everyone on this call included, but we don't have enough opportunities to share knowledge with each other. So people oftentimes work in silos, and it doesn't allow any change to really happen because many people are left out of the fold. Many people don't know what's going on and they don't know how to engage with the system. So I think that this is a critical time for us to really leverage what's happening to paint and imagine the future that we want to see. I think things like a livable wage, I think things like healthcare, I think having access to water, like these are all things that we're seeing now that they are possible. And they were always possible. So how do we maintain that out of an emergency state? So that's something that I've been doing a lot of organizing behind. I hold community meetings every Tuesday at 7. It's a collective coalition space for people to come to share knowledge, share these actions, things that community members can do to start leveraging the power that we have, because the reality is there's 99% of us and there's 1% of people that are controlling everything else. So as soon as we stand in solidarity with each other and we start realizing that all of our issues are interconnected, the sooner we're going to be able to see some real tangible change. So with having said that, for those of the attendees on the call, I will be sending out an email with an invitation to that meeting, just so you guys have access to the space. And I think that we have some questions in the Q&A. I think one question was in the chat, so I want to honor that question. It says, could one of the panelists speak on the social determinants of health and how it is shaping the pandemic and communities of color? Does anyone want to answer that question?
Happy to jump in. So my first job out of grad school was I was a professor in epidemiology, and my work was all on the social determinants of health. And ultimately, it's what led me to jump into public service, because we sometimes think about health as being a thing that exists unto itself, as if these things happen at random. And it's easy to think that way, right? Because like, you know, a heart attack feels kind of random. But it's not at all random. In fact, the things that predict people's health have less to do with the biology under the skin and a lot more to do with all the things that bombard people outside the skin. And we're seeing that happen now. Your ability just to be able to quote unquote work from home is a function of a whole set of decisions that were made about where people like you got to live, what kind of jobs people got to work, what kind of schools were there, what kind of educational pathway, even if you got through high school, existed, the kind of air that you got to breathe, the kind of water, if at all, you got to drink, the kind of food that was available in your neighborhood, the kind of housing, whether or not it was financed, whether or not your family was able to get financing 50 years ago. All of those things now shape the resources that you have to engage with in your daily life. And nowhere is that more clear than, in fact, the city of Detroit. There's a really a curve that I always used to show to explain the role of context, which looked at life expectancy among people who earn less than $28,000 per family of four, which means poverty. And what they showed is New York and Detroit. And it was on the x-axis you had you had earning income, right? So earning income, and then the y-axis, I feel like I'm doing a TikTok now, and the y-axis is life expectancy, right? And so what happened is they looked at two curves, New York and Detroit. So they look about the same at the 95th percentile, but as they fall, they start to spread. And the thing about Detroit versus New York, where I used to teach, is that in Detroit, you had substantially lower life expectancy the poorer you got. And the reason why is because context itself matters. The place that you live in matters. It shapes your access to all of these basic resources. So in New York, even if you don't have much money, you can, like, a mile away, right? You're literally in the Upper East Side, which is one of the richest parts in the entire country. And so context brought a lot of those things with you. Whereas in Detroit, you just have concentrated poverty in a city that is less dense than it needs to be, where very few people can get around because we decimated our public transit system, and allowed our insurance system basically to X out people who don't have the income to be able to support it, because we also let it be a healthcare system too, and a place where, because of the lack of density in a city, it's not even like you can pool your resources together as a community and afford even something as basic as a grocery store. And so concentrated poverty matters a lot. All of this is to say that who gets sick and who doesn't has everything to do with all of the ways that we pattern access to all of the other resources that exist. And that's playing out now in the middle of this COVID pandemic in some pretty profound ways.
We have another question from Helika. It says, I have several family members who refuse to quarantine because they think the spread of COVID-19 is inevitable and that the economy is more important. What would you say to them to convince them that this is something they need to take seriously?
So I'll just say briefly that I was concerned about my family as well, just adhering to all the social distancing guidelines. I was worried, especially for my dad, who likes to go to the library every day and just has a very particular routine, and basically was going to the library until they shut it down. And so I definitely resonate with that, was concerned about that. And I think the thing that I've tried to explain to people who are concerned about the economy is that we're in the situation we're in, not because of the governor's stay-at-home order or the president saying that you need to stay at home. We're all in our homes. Of course, we're listening to those guidances and the executive order, but the economy isn't moving because I'm not going to a restaurant whether the governor says it's the economy is open or not. So I think people need to realize that people aren't going to restaurants, bowling alleys, movie theaters because it's not safe. And it's a question a lot more about public health than whether the president says, all right, economy, you are now open. So I would just say that it can feel, I think a lot of times like we're losing control, and you're taking control by just living your life normally. But I think that's a false sense of security. I think I would try to explain that the economy is not going to be better until public health issues are addressed. I would just try to explain that.
I think another thing too is being mindful of like the people in power and what's driving the decisions that are being made. The decision to reopen the economy, is that something that is in the best interest of public health, or is that something that's in the best interest of the economy and the corporate 1%? So I think that that's something to pay attention to too. And I'm really interested to see what happens in Michigan with rumors that we might be reopening our economy as soon as May 1st or in a tiered way, whether that's in the best interest of our public health. So that's something that I'm thinking about too. Go ahead.
Can I add one short thing?
Yeah.
Yeah, I also think it's important to stress that the more we adhere to social distancing, the quicker this will be over. So by not adhering to it, you're not doing anything other than prolonging how long it's going to be around. So I think that's important to touch on as well.
So we have a question here from Tomika. How do we funnel all of this collective trauma most of us have experienced during this time as power and hold those responsible truly accountable?
I want to go first, Tamika. Thanks for raising this question. Truly, what's happening here and what each of the panelists have gone through is the fact that this myth of us having a broken democracy or a broken system just isn't true. It isn't broken. It's working exactly as it was designed. It just wasn't designed for most of us. And as we've noticed now, like the slightest pressure put on the system, as everyone just says, has completely crumbled our social structure. And so we do need change, but it has to happen not at the level of, well, we need our schools to do more online classes in case the kids have to stay home a couple months out of the year. No, that's not where we need the change. We need to peel apart the layers of why these disparities are happening socially and who's responsible and how to organize around those. So for those of us who organize in predominantly Black and Brown and immigrant communities, it's so important to understand how exactly can we build the power, because truly we haven't gotten there yet. If our zip codes are still the ones with the worst air, with the worst water, with the most high density of population, with the most disease spread, with the most inaction from our medical professionals towards our people. So how can we peel apart those layers and organize? And I think that one of the best things that I see in movement politics is when the people closest to the problem are the ones who run and win and become solution makers for that specific problem. So once we come out of this, I think people who have lost family members to COVID, people who lost school semesters and graduations to COVID, people who lost their businesses to COVID are going to be ripe for organizing and for understanding, hey, things outside of just my household or my business can affect change. And so plugging them in as some of our speakers, some of our motivators for changing the system, I think will be a really interesting change.
I completely agree. And I think historically, any change that we've seen has always been from the bottom up. It's been community members like us who have come together and fought for something, you know what I'm saying? And I think now is the time that we can really, really leverage this moment. And I think that there is momentum. And I think that there's so much that has come to light in terms of how much we can actually accomplish just based off of what we've been, given. So I think that this is a really critical time. And as a community organizer, like I said earlier, for those of y'all who want to start putting in the work, like I'm here and I am ready to go. So I think with that being said, we're at 7:03. So I want to thank everyone for joining the call. All of those who tuned in on Facebook, thank you all so much. To our panelists, thank you. Thank you for all your insight. Thank you for giving us tangible things we can do, tangible actions that we can take. I've written everything down. I plan on disseminating this information widely, and I hope everyone has a wonderful evening. Thank you.
Thank you.
Thank you, everyone.
Thank you.
Thank you, NextGen.
Thank you.